series with cell death. So in this video we are going to talk about the apoptosis. In previous video we are talk about the necrosis, and it is in this video we are going to talk about the apoptosis. So what's the meaning by apoptosis? So remember that, guys, apoptosis is a type of programmed cell death. What kind of programmed cell death? And it is a mechanism to eliminate the unwanted cells. Like that, necrosis, it is an unprogrammed cell death, but apoptosis is a programmed cell death. And in this particular apoptosis, only single cell death can occur. Only one cell can undergo apoptosis, but in the necrosis, large group of cells are died together. So normally apoptosis are mainly two types. It can be in two conditions. It can be physiological and it can be pathological. What are the meaning by the physiological apoptosis and what are the meaning by the pathological apoptosis? So normally example of the physiological apoptosis, it is include the during embryogenesis or organogenesis, some restriction of the cells. So normally, guys, when embryogenesis occur, when our organs are developed, example like our hand, it is like totally like that, but now we can open it. Here's a gap. So there are some cell that are dead. That process is a physiological process. During embryo, our hand is like that, but when we are become mature, our hand is like that. This is occurred due to because of the apoptosical process to remove the unwanted cells. So we can movement our fingers. And other example is includes the involution of the hormone dependent tissue. So normally example is menstrual cycles. So during the menstruations there are high level of estrogens, then progesterone is support the endometrium, but when we withdraw the hormonal support, it can lead to the shedding of the endometrium and the menstruation again. So it is also an example of the physiological apoptosis. And last example is the removal of the harmful self-reactive lymphocytes. So what's the meaning by the removal of harmful self-reactive lymphocytes? So this process is mainly occurred by the negative selections. This is occur in the thymus during the development of the T cells. For more detail, you can go to the immunological section. You can see about this development of the T cells. In that example, you will find about that. And what are the pathological examples? So normally, guys, pathological example includes there's a DNA damage by any external factors. So if any external factor come and that can damage the DNA, so cell is become abnormal. So if the cell is become abnormal, we should need to remove that cell now. Otherwise, it can become the cancerous cell. So for removal of the cells, the apoptosis occur in that conditions. Okay. And other is the accumulation of the misfolded proteins. So misfolded protein disease. So if in the cytoplasm, if too much misfolded proteins are accumulated, it can lead to some disease. To prevent this disease, there's also apoptosis. Cell will undergo apoptosis. And last example is infections like hepatitis B. So normally, what are the morphological features of apoptosis? So normally there are 5 key features of the apoptosis. First, you should need to remember that 5 key features. Number 1, decrease in cell size. This is the earliest. I will show you in the image. Now just listen to me and try to remember this. Number 1, decrease in cell size. This is the earliest feature. Second one is the plasma membrane are intact. And third one is the inflammation is absent. Fourth one is the formation of the cell membrane bleb. And 5 one is the chromatin condensations. Okay, guys. So now let's see in the image. So here and decrease in cell size. So you can see cell size is decreased, and it is the earliest features. And second one is what? Plasma membrane is intact. So as you can see clearly here, plasma membrane of the cell is intact. And normally inflammation is absent. So here no inflammatory cells are present in this condition. So inflammation is absent. Number 4, formation of the cell membrane bleb. So what's the meaning of cell membrane bleb? So as you can see here membrane become like this, bleb like appearance, and after this part is detached. That is called as the apoptotic body. So if your questions are come, what's the meaning of apoptotic body? So don't get confused, guys. Normally apoptotic body means composed of membrane bound contain organelles. So if that detached, so cell membrane is also detached along with that, and cell membrane bound organelles also come along with that. And what's the appearance in microscope? It is an eosinophilic appearance in microscope. Here you can see apoptotic bodies, eosinophilic appearance. And last one is the chromatin condensations. What is the last feature? Chromatin condensation. And remember guys that chromatin condensation is the most characteristics feature of apoptosis. So if question is come, what is the most characteristic feature of the apoptosis? So it is a chromatin condensation. So guys, once again revise this. What are the 5 morphological features of the apoptosis? Number 1, decrease in cell size, and it is the earliest features. Second is plasma membrane is intact. Plasma membrane is intact. Third one is inflammation is absent. Number 4 is formation of the membrane bleb, and number 5 is chromatin condensations. So in there, after that, regulation of apoptosis. So there's a certain mechanism that can regulate the apoptosis. It is not like necrosis that's always pathological, that unwantedly occur, but it is a wantedly occur. We want apoptosis for our normal life purposes. So what's the regulation of apoptosis? So remember guys, one very important point, it is a gene dependent. What guys? It is a gene dependent. Like that necrosis, it is a gene independent. So guys, what are the examples in the gene dependent? So there are normally 2 group of genes, pro-apoptotic genes and anti-apoptotic genes. So if there are pro-apoptotic genes, if this become activated, that can lead to the activation of the cell undergo apoptosis. And anti-apoptotic genes, these genes are always active. Remember this guys, anti-apoptotic genes are always active. Okay guys, so by this always active, that's why normal cell not undergo development, because anti-apoptotic gene always active. So normally what gene are come under the pro-apoptotic and what gene are come under the anti-apoptotic? So backs and back. These are the group of the pro-apoptotic gene. And what are anti-apoptotic? BCL2 family, that includes the BCL2, BCLXL and MCL1. Okay guys, so if there's any damage to a cell, so there's some sensors are present, that stress sensor that present, and that activates the pro-apoptotic genes. So what's the stress sensor in that conditions? That sends the stress and activate the pro-apoptotic gene, and that can lead to the cell death by the apoptosis. So certain gene that is also act as a sensor. This gene are the beam, bead, bed, puma, noxa. Remember guys, beam, bead, bed, puma, noxa. Sometimes one liner can directly ask from these topics. Okay, so what's our next? The mechanism of apoptosis. What are the mechanism of apoptosis? So normally apoptosis is occur in the 3 phase. Remember guys, apoptosis is occur in 3 phase. What are these 3 phase? Number 1 is initiation phase, number 2 executional phase, number 3 removal of apoptotic body. Number 1 initiation phase, number 2 executional phase, number 3 removal of apoptotic body. And in this 3 phase, 2 enzymes are very important, and that 2 enzymes includes the caspases and endonucleases. Okay guys, so what's the meaning by caspases? Caspase, as per the name, it is cas, that means it is a cysteine, contain cysteine. Here cas contain cysteine, and it is a cleaved the aspartic acid. Here it is cleaved the aspartic acid residues. Okay guys, remember this caspase. And there are 2 types of caspases, initiator caspase and the executional caspase. Initiator caspase are the 8, 9, 10, and executional caspase are the 3, 6 and 7. And after this, what is the most important caspase? It is in 3, 6 and 7. It is the most important because activation of the executional caspase that can lead to the apoptosis. That's why it is the most important. Okay guys, and other enzyme is endonuclease. As per name, it is clearly said endonucleases. So it is break down the nuclease. So nucleus, in the nucleus where what have mainly have, we have DNA. So the indirectly breakdown of the DNA breakdown. And if we are trying to find out whether DNA breakdown occur or not, we have a gel electrophoresis. If we see the gel electrophoresis endonuclease activity, it can occur like a step ladder pattern. Now guys, you are confused. What's the meaning of step ladder patterns? So here in gel electrophotometry, and if it is seen under the microscope, we can see the small segment. So what's this small segment, guys? So normally this nothing. These are your base pair like adenine, guanine. So at one particular area 2000 base pair present, at one area 1000, then 5000, then 200, then 100, like stepwise it is present, because due to fragmentation of DNA. So it is indicates the activity of the endonucleases, and cell is under the apoptosis. So it is also one hallmark feature to find out cell is under apoptosis or not. But remember this, guys, in necrosis we not have endonuclear activity property, so it's look like smear pattern. What's the meaning of smear pattern? The step ladder like that, and smear, it is a longitudinal appearance. Here you can see in image. Okay guys, is that clear? So I already tell you apoptosis mainly occurs in three phases. Number one, initiation phase, executional phase, and the removal of apoptotic body. So first of all we are going to talk about the initiation phase. So normally by initiation phase occur by a two pathway that can lead to the activation of the common pathway. It is an executional phase, activation of the executional phase. So normally two phase, and it is occurred by the two pathways, intrinsic pathway and extrinsic pathway. What's the meaning by the intrinsic pathway? Intrinsic pathway is also called as a mitochondrial pathway. So with the help of mitochondria, this pathway is occur, and it is a mostly cell undergo apoptosis by the which pathway? Intrinsic pathway. 90% are cases. And what most common organelle affected in apoptosis? It is a mitochondria. That is the most commonly affected during the apoptosis. Remember guys, this is important one-liners. And what meaning by the extrinsic pathway? Extrinsic pathway also called as the death receptor mediated pathway, and this is only occur in 10% cases. And in which condition we mainly see? In the T cytotoxic cell killing. So some cytotoxic T cell that killing RNA, bacteria, that occur via which pathway? This pathway, extrinsic pathway. So now we are going to see about the pathway in some details. What are the meaning of mitochondrial pathway, or also called as intrinsic pathway? So remember guys, normally mitochondria, here I draw one mitochondria. So normally mitochondrial inner membrane have one very important enzyme, that is cytochrome C, that always present inside the mitochondria. If this enzyme come out from the mitochondria, this become very dangerous for our cell, and our cell is undergo apoptosis. So for prevention to this come out, there is a group of genes that are present. What I already told you, this is an anti-apoptotic, that always active, that here they make the block channel, so not able to come out. So here from the image I can directly share this image with you from the Robbins. So normally these are viable cell, and these are apoptosis. So when there are survival signals, example, so if the survival signals are present, if growth factors are present on the outer receptors, so there are continuous production of the anti-apoptotic proteins. Anti-apoptotic what? BCL2 family protein. So here BCL2, BCLXL. So it blocks the coming out from the cytochrome C. So cytochrome C is not able to come out from that cell. So no leakage of cytochrome C. But due to any reason, there's a radiation or due to any other DNA damage, that can lead to the lack of survival signals. So now the lack of survival signals and the DNA damage, so first of all that can lead to activation of what? Our most important, that I already tell you, activation of stress sensor. So that stress sensor is beam, bed, puma, that activation of sensor that belongs to the BH3 only protein. Now you are confused guys, what's the meaning of BH3? So nothing, it is a class of that beam, bead, BEXA. So normally it becomes sensor is activated, and that can lead to the antagonize the BCL2, and BCL2 what? Anti-apoptotic. BCL2 is what? Anti-apoptotic. So of course, if the BCL2 is anti-apoptotic and it is antagonized, so that can lead to the apoptosis of the cells. Apoptotic genes become active. That can lead to the activation of back channels, and that can lead to the leakage of cytochrome C and other proteins. when this cytochrome C come out from the mitochondria, it can go and bind with the very special protein that present in the cell membrane. It is a bind with apoptotic activation factor. So cytochrome C plus apoptotic activation factor, that make what? Apoptosome. That means apoptosome. This apoptosome go and activate the what? Caspase 9. Remember guys, what is the caspase 9? It is an initiator caspase. Now that can lead to the activation of what? Caspase 3, 6, 7. This is our executioner caspase. So this is also called as executioner phase. So first is initiation phase, second is executional phase. I hope guys this is clear. So this 3, 6, 7 that can become activate, and that can lead to the activate, and then cell undergo apoptosis. So this is all about the intrinsic pathway. Once you go through this, you can remember. Second is extrinsic pathway. So what's the meaning by extrinsic pathway? No involvement of the mitochondria. So normally here one T lymphocyte is present. One T lymphocyte is present. On the surface of the T lymphocyte, there's a fast ligand receptor are present. And on the other side of the cell, we have the fast receptors. When fast ligand receptor and the fast receptor are bind together, that can lead to the activation of the fast associated death domain become active. Okay, that can lead to activation of the fast associated death domain become active. So it is a death domain dependent pathway. Also it is an other name. So that can lead to the procaspase 8 that normally present. It is an inactive phase. Okay, normally procaspase 8 are inactive. But when this complex are formed, what complex? Fast associated death domain are formed, that can lead to the activation of the caspase 8. Now this caspase 8 go and activate our what? Executioner caspase. That are our executioner caspase what? 3, 6 and 7. 3, 6 and 7, and that can lead to apoptosis. So normally both pathways are trying to activate what? Executioner caspase. So both pathway one meet at one point. That's a common pathway, then that it is follow. So this all about the extrinsic pathway, and this all about the intrinsic pathway, and this all about the extrinsic pathway. So our last phase that includes the removal of the dead cell. So after the cell is die with the process of the apoptosis, it is mandatory to remove that cell from the unwanted cell to remove the body. That occur with the help of what? Macrophages. Macrophages come and engulf this cell. So how macrophages is detect that I should need to eat this particular cells, otherwise it can eat all the cell na. But macrophages have a signal to I only should need to eat this particular cells. So first of all we are going to see the normal cell. So in normal cell, phosphatidylserine is present on the inner membrane. So here phosphatidylserine is present on the inner membrane. Okay, but in apoptotic cell, what happened in apoptotic cell? In apoptotic cell, phosphatidylserine come to the outer membrane, and when this phosphatidylserine come to the outer membrane, this give macrophages to what signal? Eat me signal, and that can lead to the macrophages attract this eat me signal and come and engulf this cell, engulfed by macrophages. So this procedure is called what? Phosphatidylserine flip. Guys, remember one very important point. The marker to detect apoptotic cell, where to detect that cell is under apoptosis or on not, scientists develop one very special marker, that is annexin 5. So in apoptotic cell always one marker present, that is annexin 5, that positive for that cell, that means cell is under apoptosis. If this marker positive means cell is under apoptosis. So guys, that's all for apoptosis. In previous video I told you about the necrosis. In this video I told you about the apoptosis. So now I am mainly going to the what are the difference between the necrosis and the apoptosis, to summarize in one table. Okay guys, so here features, here necrosis, and here then apoptosis. So as you remember guys, in cell size, what there in necrosis there is swelling, so enlarged, but in the apoptosis that cell size is reduced. And what for the nucleus it is undergo pycnosis, karyolexis and karyolysis. This is nothing, this is a type of nucleus that nucleus is fragmented into small pieces. And what happened to apoptosis? It is also a nucleosome size is fragment is a nucleosome, but it is a slightly big size. In the necrosis it is become very small. There's a difference. And what about the plasma membrane? In the necrosis there's a leakage of the enzyme because plasma membrane is totally disrupted. But in the apoptosis there's no leakage of the enzyme, so there's a plasma, because the plasma membrane is intact. That's why plasma membrane intact. That's why inflammation is not present in apoptosis, but inflammation is present in the necrosis. What are the cellular content? So if the plasma membrane is disturbed, so of course cellular content and enzymatic digestion may leak out of the cell. Okay guys. And in the apoptosis, in the apoptosis the enzymatic intact and the enzymatic content that present inside the cells, and that is released in the apoptotic bodies. As previously I told you, there's a formation of the what? Apoptotic bodies. Here apoptotic bodies are formed. Okay, in this apoptotic bodies are formed. So enzyme are intact. And what about the adjacent inflammation? So I already told you, because the cellular contact is leak out, that can in the necrosis, so inflammation is present in the necrosis, but in the apoptosis there is no inflammations. So remember guys, and the last one is, it is physiologic or pathologic. So normally necrosis is always pathologic, and apoptosis, I already told you, it can be physiologic or it can be pathologic. I already shared with you the examples. So that's all for today about the apoptosis. In next video we are going to talk about the other types of cell death. Thank you.